Hello and welcome to Lessons My Patients Taught Me. I'm your host, Dr. L.A. Davidson, family doctor, coming to you once again from my home studio in Solon, Ohio. This is podcast number 80, and as always, we explore the lessons that medicine and our patients teach us over a lifetime in practice. Every now and then, I meet someone in medicine who seems to be operating on several levels at once. Clinician, teacher, innovator, entrepreneur, and storyteller. My guest today is one of those people. Today I'm delighted to welcome Dr. Rahul Damania. Rahul is a pediatric intensivist at Cleveland Clinic Children's, an inspiring educator and the creative force behind Hi Guru, one of the most dynamic board prep educational platforms in medical education today. Thousands of medical students know him from his energetic YouTube teaching videos, where he's made notoriously difficult concepts in medicine understandable and even enjoyable. I first discovered Rahul through his online teaching, and then I recently had the pleasure of meeting him in person when he was inducted into the Alpha Omega Alpha Honor Society at our shared alma mater, NeoMed, Northeastern Ohio Medical University. What strikes me most about Rahul is that he combines deep expertise with uncommon warmth. On his website, Hi Guru describes him as fiery and infectious, a born teacher and motivator, committed not only to helping students score well, but to showing the real relevance of basic science to clinical medicine. After graduating from NeoMed, Rahul completed his pediatric residency at Case Western Reserve University, his fellowship in pediatric critical care at Emory, and he later earned a master's in medical education from the University of Pennsylvania. But that's only part of the story. He also is a TEDx speaker, host of the podcast PICU Doc on Call, an associate pediatric clerkship director at Cleveland Clinic Lerner College of Medicine, and he is the director of academic advising and an epic physician builder, and someone deeply engaged in the future of AI in healthcare and medical education. Rahul, you are one busy and creative physician. I am so glad you could join us today.
Thank you so much for having me.
So let's just start off with your story. What first drew you toward medicine and why pediatric intensive care?
I think my story towards medicine as well as pediatric critical care, I can sum up as nature and nurture. I have been very humbled to have a great familial support system in which many of my family members are physicians in various different specialties. And I think that that innately drove a curiosity to pursue sciences. And when I had the opportunity after high school to enroll in the direct BSMD program, it really channeled that cone of focus even more, as now I was able to really expand and immerse myself in the field of medicine. And fast forward to my second year of medical school, I had a very formative event, and that was when my sister, as a young M2, and my sister at that time was 11 years old, she had a very severe intraventricular hemorrhage, and that landed her in the pediatric ICU at Cincinnati Children's for about 24 days. And I still remember, I'll give you this imagery, which is crazy, but I remember having my respiratory physiology book open and looking at spirometry. And then I look up and I see my sister's spirometry curve on the ventilator as she was being mechanically ventilated. And I would not wish this on my worst enemy, but being on the patient side of family-centered rounds has really driven me to be the best physician I can be. And it comes all full circle where my sister was admitted in the PICU, and that was a very formative event. And now I'm kind of on the other side, on the provider side, being a pediatric intensivist, and that's a really big full circle moment for me.
That's interesting because I had a similar experience when I was in medical school taking neuroanatomy, and I had a great uncle who had a stroke, and he had very, very significant neuro findings, with his eyes deviated a certain direction. And we had a brilliant teacher, Ted Venida, at that time, and he helped us focus in terms of figuring out where the lesion was, and I could tell exactly where the lesion was based on his symptoms, and I was able to say I know exactly where his stroke was, and it turned out to be correct, and it just was kind of empowering that I understood what I was learning was going to have clinical application.
Yeah. It's amazing how when medicine gets contextualized in your own domain or familial circle, how much that strengthens the resolve to really apply science and empathy together to be the best physician you can be.
Yeah, now you've also become one of the most recognizable physician educators online. What made you realize that teaching board prep could become something much bigger than tutoring?
Yeah. It's quite the story, and I always like to joke and say that at the back of my medical school library in the quiet section, I used to just tutor for $20 an hour, and then I would go to my roommates. All of us together would go to Kent Water Street and blow it at the local pub. And obviously, that is a very comical way to start the story, but I will say that that really laid the foundation of being an entrepreneur and being an innovator in the field of medical education. One thing that I center myself on, and I still tutor to this day, is that the best way to build the mass impact of, let's say, an online educational course or a company is to always stay at the ground level and tutor students one on one. And I find that the plight of me just understanding where students are coming from on a one-on-one basis allows for me to create so much velocity or so much breadth in terms of content, and allows for me to really be agile. A great example, concrete example, is the USMLA just came out with a announcement that they are going to emphasize nutrition-based content a little bit more starting in June 2026. And me just sitting down with students and recognizing, hey, that is an area that students feel uncomfortable with. Just this past week, I spent about 6 to 8 hours trying to look at all the different nutrition pieces, everything from vitamin excess to deficiency to the biochemistry surrounding nutrition. And I compressed that into one review. And I gave that as a free webinar, and over 2,000 students joined. And I don't think that I could get that impact by just trying to go from up down. I think a down up approach really allows to be innovative in this type of domain.
And you enjoy, taking a complicated subject and kind of like bringing it down to an understandable essence. Your teaching style is energetic, clear, memorable. I watched a number of your videos. How did you develop that style, and what do students most need that traditional medical education often misses?
Yeah, that's such a great question. And I will tell you that I may have just fell into this. When I started High Guru, I always just centered on thinking like the test maker. And in those days, I'm talking even 2012, you had great test prep companies. They're wonderful, but this is where the gap was. They were teaching medicine in a very linear manner. So they would take anaphylaxis and they would list as bullet points on a slide symptomatology, wheezing, urticaria, bronchospasm. When in reality, I knew that patients present in a completely different way, and test questions are being written in a way that is much more clinical vignette oriented. So I took that same slide and I did one simple thing. I started saying, a 4-year-old just came out from a birthday party and has a red rash on the skin. And suddenly, I started teaching concepts in a more vignette style, starting with the patient symptomatology. And oh, wait, I then centered on the number one core of being a physician is the application of foundational sciences. And so that teaching pedagogy, I coupled with in the last 2, 3 years, I got my master's in medical education. I coupled that with robust learning science literature. And one of the things that I'm focused on now is how do we teach these complex topics, but make sure that we break down the intrinsic cognitive load, which is defined as the inherent difficulty of the material, increase the germane load, which is creating schemas surrounding these topics so that students have a framework of understanding. And most importantly, and this is where, unfortunately, I think many medical institutions may get it wrong, how do we reduce the extrinsic cognitive load? And extrinsic cognitive load is defined as how many bells and whistles and extraneous information and heterogeneous delivery pattern is there. And we see that if you look at the traditional med school course, we have 50 different lecturers who have 50 different slide types, who have varying amounts of text on the slides that are saying some things are important, some things are not. And this creates this confusion swirl for students that, oh, wait, now they are pivoting to third-party resources rather than focusing on the traditional lecture.
That's fascinating because one of the most difficult things that some medical students have is prioritizing. Even when they get into the clinical years, they can't dissect out what's important, what's not important. They want to give you everything because they're afraid of not giving you enough. And I guess the same thing could be said with studying. If you're trying to study everything, you can't study anything.
So true.
Now, High Guru has become a real educational brand. What has been the biggest challenge in turning educational passion into entrepreneurial success?
It's such a great question. I'll give you the answer that is more aligned to when I was a trainee compared to now when I'm a staff physician. As a trainee, I feel like I was a double agent. And I also felt like I was a grimy salesman because entrepreneurship was not as celebrated as me, quote, being a good resident and focusing on residency and coupling that with academic papers that then built your niche, so to say, to get a faculty position. And so I had to be pretty much under the hood in developing High Guru as I was a trainee. But I was really grateful to do that because obviously I was pushing myself outside of my comfort zone. 3:45 a.m. wake ups before going into rounds, making sure that I would have time allocated during the weekends so that then I could work with students one-on-one and line up 6 hours of one-on-one tutoring back to back to back. And it seems like a big hustle and grind. And why did you do that? And the number one thing I just kept saying is if I keep iterating, not wait for the perfect moment, i.e. after training, and I just keep iterating now, I think I can continue to refine my craft. And that's what really has driven the High Guru's success. I will say, and I'm not trying to be flippant by any means, but this is to any young entrepreneurial spirit that is listening to this. When you eat shit in your 20s, you will have a beautiful life afterwards. And I think
My,
sometimes what happens is that we end up having these time periods where we may rationalize and say, no, I can't do it. It's not the perfect moment. But I will tell you that I centered myself on one belief. The most dangerous person in the room is the one who can act under imperfect circumstances. And this is my answer in residency because obviously in residency and fellowship, I'm trying to be a really good resident and fellow, and I'm building this brand. And I will tell you, I got so much backlash from my program directors. Why are you doing this when you're supposed to be focusing on this? But guess what the missing gap was? When some of my co-residents and fellows, not to say there's anything wrong with this at all, when they're going home and watching Netflix and drinking wine on the couch, I'm teaching the schemas of cardiac output with, oh, wait, doesn't that have a good correlation to pediatric critical care? And so I think that the marriage of me building this education passion, coupled with me being a physician that still practices at the bedside, has been the greatest pleasure for me because outside of my professional life, i.e., my clinical life, I'm able to hone in on the fundamentals of sciences. And I couple that significantly with one key thing that I tell students. Hey, did you know that I saw lactic acidosis last time on call? And that is where pyruvate goes to lactate. And students get the best dopamine hit when you say those words. I just saw this in a patient.
yes, yes, because these things really happen, and they love to see that correlation of what they're studying happening in the real world. So let's bring it down to the real world. In the pediatric intensive care unit, you're meeting families during some of the hardest moments of their lives. Talk a little bit about what have your young patients and their families taught you about resilience, hope, perspective, things like that.
Yeah, I'd love to hear your take on this as well, being such a experienced clinician. And to me, being on the patient side of things, like I mentioned, has really humanized me as a physician, as I really understand what it's like to be next to your child or your closest family member at their most vulnerable times. One thing that I have centered myself on as I've gone through this, and I'm still very much learning, is that the essence of pediatric critical care is not just taking care of the child, but taking care of the whole family unit. And there are so many dynamics of the family unit that you have to balance. And you, in fact, are not just an ologist or a expert, but you are trying to be a master communicator amongst various disciplines, as PICU is a team sport. And then here's the common theme: you are an educator to your patients of breaking down the complex intricacies that's happening in their child and prioritizing which one is important for them and explaining that in a way that is going to be in correlation with their value system and health literacy.
Can you think of a case that kind of brings out these?
It's a great question. I have found that a patient population that has been very challenging is the bone marrow transplant population. And the reason why I say that is because children who undergo bone marrow transplant, at times they are trading in one malady for the next. Let's say you go in for a bone marrow transplant for sickle cell disease. Obviously, sickle cell disease is such a really challenging, debilitating disease, but the complications of a bone marrow transplant is also very challenging with graft versus host disease and the immunocompromised state that goes along with being a BMT recipient and patient. I will tell you that my sensitivity and the way that I deal with these families are a little bit different compared to, let's say, the run-of-the-mill ICU bronchiolitis patient that comes in. And the reason why I say that is because these patients, these families, excuse me, have gone through the journey with their child for so many months, months on end, that their perspective of hope and their perspective of resilience is a bit different, as they've been so much navigating the healthcare system and have had these emotional ups and downs. And so that really allows for me to make sure my messaging is very aligned to the context of what they've been through and really framing genuinely. And I just did this not too long ago. Is this a quick sprint that we're going through, or is this going to be a marathon that we need to all put our seatbelts together and ride the storm together with? One other perspective that I will say is that another important patient population, I'm sure you have also dealt with them, is the complex care population.
Right.
These complex care populations, they have parents that are such advocates. Every wince, every cry, they know exactly what that is because these children can't communicate. I take that extremely seriously. And I have made sure to, again, center myself on it's not just about the patient, but it's about the family and the journeys that they have been going through.
Has there been a specific patient encounter that changed how you teach or changed how you live yourself?
I would say that it is a culmination of many patient encounters that I'm very deliberate on reflecting. In terms of how I teach, I will say that there are many families that invite other learners and trainees. And there was one specific family who the child had a abdominal like a ascites, and we don't see that too much in the pediatric population, as we don't see too much liver cirrhosis. But in that moment, I was very hesitant to say, man, this family has been through a lot. They're critically ill. Child is there. I'm very hesitant to teach at the bedside, which I think that's what really stimulates learners, as I'm sure you know as well. And I was very surprised when the family was like, no, it's okay. You can bring in the ultrasound and do a point of care ultrasound to show your learners. And I usually frame it by saying, this is just for teaching purposes. And I really want to allow for you to be a part of this and let us know if there are any times where you feel uncomfortable about it. But this really just empowers me, that specific scenario, that it's okay to ask families to have, even in their most challenging of times, bring other learners in, because sometimes families are so inspired by the fact that their child is helping inspire a next generation of physicians.
Yeah, with all that's going on with them, they're not sure if they're going to get better or not, but they want to make sure that they're whatever's going on with them, maybe it's going to help somebody else in the long run too. So they're happy to see that. We have so many, having worked in a residency now for 25 years, all the patients are so glad to be part of that and to be able to be in the educational process. Just to shift gears a little bit, another thing that you um, spent a lot of time on is AI and informatics. And we've been talking about AI in the last few episodes, and it's hard to ignore. It's just kind of changing every day, every week. I'm wondering what you think AI will do and how it will change the way future physicians learn medicine?
It's a very complex question, and I think my answer changes every day or week because there's so much coming out now with AI. And one theme that I have always been focused on and comes into my teaching practice and clinical practice is the fact that AI is a tool that can augment and unlock our hidden potential as physicians. But the way that we embrace AI is kind of like a scalpel that we use for procedures in the ICU. It has the ability to sharpen our clinical reasoning, but just like a scalpel needs a sharps container for proper disposal, when we are going to utilize AI, we need to be careful of the ethics surrounding it, the transparency that we used it. And in addition, and this is what I'm worried about in upcoming learners, the cognitive de-skilling that can occur and the cognitive, I call it obesity, that can occur when you're too reliant on it. There's already literature out there. My colleagues, Adam Rodman et al., they already have proven the fact that an clinician plus AI improves the diagnostic accuracy of a certain clinical encounter. However, my ploy is to make sure that we understand that we must teach the clinician the core tenets of clinical reasoning without AI before introducing that in. And I think that's going to be a challenge for institutions, as many of these learners coming into a medical school have already utilized AI for high school, for undergraduate, and now to take that away from them with structured formative assessments and teaching them skills without AI, and then at the end, sprinkling back AI, this is going to be, in my opinion, the next paradigm in the next 5 years of medical education.
That's, I think, a very good answer. I am intrigued by your term cognitive obesity. To me, it's more like cognitive laziness. What do you think about that?
I think that laziness can definitely contribute to obesity. I'm curious to hear, what does cognitive laziness look to you?
Well, if you're too reliant on AI to do too much of the work for you, so that leads to the de-skilling that you were talking about. And if you are not, just like anything else, if you're utilizing a muscle, if you're utilizing a clinical skill, a cognitive skill, it's going to continue to grow and strengthen. If you don't utilize it, it's going to atrophy.
Absolutely. I agree with you. And I like the workout analogy. I think one part or layer that I can add into this framework is to this moment with AI helps us understand as educators and clinicians, what are the core skills of a physician? And can we define those core skills? Is the core skill of a physician to be a master diagnostician? Is it to improve management reasoning? Is it to be that empathetic soul next to the patient? And once we can define that these are the skills that are important, then we can try to see, how does AI help or hurt us? And what skills do we need to preserve without AI? And what skills are amenable to making AI be in concert or augmentation with? This is a very complex topic, as you know, but this has been something that I've been focused on because many of the presentations that I've done, let's say in the last 3 years, have just been AI, AI, AI. But in reality now, it's not capital A, capital I. It's starting to become little a, little I. As much as we're diving into it, we're recognizing that the Gartner hype cycle is now going towards the trough of delusionment.
Okay, I'm going to have to think about that one. Now, I'm wondering what you think the future of AI is in regards to board prep, because you've been spending a lot of time. You tell me you work 6 hours on this one topic. What's going to happen with AI and board prep? Is it going to replace the human teacher, or is the human teacher going to remain central to that?
It's interesting, especially because, as you know, there's been a push in the past few years about this flipped classroom idea, in which we have the learners come in with some context and then they have a little bit more of an application-based session. And I think that AI will augment that. One thing that I want to emphasize is that AI now has the power to bring mass amounts of information into one centralized location for a learner. However, AI has also increased the extrinsic cognitive load and the context switching that a learner goes through. I'll give you a concrete example. Let's say that you have a question bank, and I see this a lot. That question bank usually has a 2-paragraph explanation that gives you the essence of what is related to the concept as well as the clinical vignette. What I'm seeing more and more often is that rather than focusing on the mastery of those 12 sentences, students find the need to say, quote, "That's not enough," or "I don't learn like that." And they end up taking the 20 vocab words that they need to know, the context right underneath that clinical question in the question bank, and they go to ChatGPT and they are going to be shifting their attention. I call this context switching. And they take those 12 sentences and turn them into 120 sentences just with the snap of a finger. And so this is, again, that balance that we need to play of how do we utilize AI in board preparation. One specific thing that I have focused on, and I created a question bank that uses AI to help you break down every single sentence in a clinical vignette, thinking about it from a lens of clinical reasoning. So you can put in my platform any question, and that question then is broken down line by line without giving out the answer, but allows for you to get coached through the vignette that this is the problem representation. This is a pathognomonic sign to a certain illness script. This is a pertinent negative that rules out this disease. And I think my hope is that AI will allow for us to shift passive learners to more active ones, but then also allow the gateway of taking a clinical vignette, which is the core of board preparation. And rather than having that skill of breaking down a question gated to a tutor that charges X amount of dollars per hour, AI can help bridge that gap a little bit more and make that skill a little bit more accessible.
That's interesting. One of the things I find when I use AI like ChatGPT is that it'll give me a really nice answer, and then it'll give me a couple of extra steps that I could take next. And it's really hard not to take those next steps. It's very, very seductive to go on and say, "Oh, yeah, 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 that's great." And then it just kind of takes you down this rabbit hole because you do that 2 or 3 more times, and then you're kind of far away from where you started. And I think that's what you're talking about with your learners. They had the answer to begin with, but then, they spent a lot of time going down a rabbit hole that they really didn't need to go down to for that particular question. So that's fascinating. So you got to be careful that you don't let it drag you that way. On a similar topic, many physicians have expertise in board prep or whatever it is that they would possibly be able to share publicly, like you're doing with your board prep and your teaching, but they're hesitant to share it publicly. What advice would you give doctors who want to create a meaningful educational content online? I know you don't want to give away any trade secrets, but
No,
what advice would you have?
I'm an open book, and I think that similar to this conversation, I mutually learn from, frankly, every scenario. I try to get that learning point, but that's the educator in me. I will say one thing that is very tangible, that has really unlocked the confidence and my overall career that has made it so fruitful in terms of engagement across the globe, has been to post on social media consistently. And that can mean anything from LinkedIn to Substack to more video-based platforms. But I always like to empower physicians to, again, act under imperfect circumstances and recognize that at times, especially if you are really doing deep research on a topic, this ends up being digital or educational scholarship. Not to get too much off of a tangent, but institutions need to start recognizing that 80 podcast episodes that are peer reviewed or that are focused on taking all the literature and putting it into one spot, that probably A, might have more eyes on it than a PubMed publication, and B, still is educational effort that a faculty is doing to help with a certain mission. In my case, is to bring pediatric critical care to many learners and a diverse set of learners across the globe. And so I think the paradigm is going to shift, but the core element that I think physicians need to focus on is we have such an amazing, I mean, if I took this, it's very graphic, but if I took your calvarium, took it off, and I was like, how much white matter do you have? Well, you have a lot of white matter. And the reason why you have a lot of white matter is because our job is to make decisions and do that risk benefit ratio very quickly. And why don't we take that smart, cortically developed brain and put it into a channel like social media where you can impact so many people by writing or recording content in your niche?
Yeah, I hope I have some gray matter too. Now, I'm just wondering, getting back to board prep, for struggling medical students preparing for boards right at this moment, what is the single most important mindset shift that they need to be successful?
I'll take a step back from this beautiful question. I have realized in my years of board preparation that a lot of the time I'm not a content expert or maybe the expert in test taking strategy, but a lot of this has been the lever of cognitive psychology that I'm helping students with. And this is something that I'll be very frank with. We are seeing more and more as we have the COVID generation or the students who started learning medical school in the COVID times and now are accelerating forward. One takeaway for any learner who is going to be traversing the board prep waters, I would say it is so important to focus on the process of learning rather than an outcome of a 3-digit pass fail score. And the reason why I say that is students usually have this domino effect, especially for step 2 CK, that if I end up getting this score on this assessment on May 11th, that is going to determine my chances for a competitive or non-competitive residency. And I like to shift the gear to say, I'm here as your board prep coach to actually help you focus on being more process oriented, because once you're process oriented, the outcome is going to come. And the beauty of life is to make sure you're acting without an attachment to the outcome or expectation. It's very philosophical, but I'm sure you can relate that the definition of frustration is when expectation doesn't meet reality. So how do we get less frustrated in life and in board prep? We reduce our expectations. That doesn't mean that we are not goal oriented, but there's a fine balance where you can still be so focused on the process of a certain goal without actually being obsessed with the fruits of your labor.
I think well said. One of the things I've always tried to do is just learn for the sake of being able to help people better. If I knew things more, if I was able to diagnose things better and knew the treatment plans, I could help people better. And that's what I was focused on, that process, and not so much on whatever grade I was going to get on a test or whatever. And when I was focused on that, everything else kind of fell into place.
That is such sage advice. And I will tell you, any student that I work with, the day before or the morning of their exam, when they go into Prometric to take those arduous 8 blocks of 40 questions or 7 blocks of 40 questions, I say, remember, each vignette is a patient. And now you have the ability to apply all of what you studied to help that patient. And good luck seeing the 280 patients today. But you're so right. We must contextualize it for our learners.
Now, last couple of questions. You juggle a lot. You juggle medicine, teaching, podcasting, AI, entrepreneurship. I wonder, I mean, your enthusiasm is really remarkable. It's very infectious. How do you avoid burnout? I mean, you started in your 20s clearly, and how do you avoid this burnout and staying inspired all this time?
Yeah. I will say I'm very grateful to have a loving support system, including my wife, that facilitates and is the spine to many of these creative pursuits. And I want to give recognition to that and even God Almighty for helping me stay fit and cognitively agile to keep up with this. I will say, and I actually get this question a lot and I keep reflecting on this. And one of the things that I will say is when your purpose and your passion aligns to that ikigai, which I'm sure you've heard that Japanese word of ikigai, which is your overall being that combines many different spheres. Sometimes I don't even feel as if this is cognitively challenging work, or it doesn't feel as much as something that I am maybe chained to. And I have found that when I am connecting with wonderful individuals like yourself or a student, that drives me even more to just keep improving. And that 1% improvement every single day I've been very grateful to see that has correlated with a great spike up in engagement in whichever domain, student satisfaction, high guru sales, all the way to helping patients at the bedside. And so I think it's a complex answer, but I do stay inspired by the process. And I don't focus as much on the outcome as much as trying to help people as best as I can.
What are you excited about building next? What's on the horizon?
I'll give you a very transparent answer. I am excited to build a family with my wife. My wife and I did 6 years of long distance. She's a practicing OBGYN. I'm a pediatric intensivist. There's a lot of adrenaline in the home. There's a lot of pre-call. There's a lot of post-call. We did 6 years of long distance, and finally, in the last 18 months, we are living together. And I think that a way I can try to frame my life and what is next is probably the season of building a family, which I'm excited to do. And I'm sorry if it wasn't a professional answer, but this is the true answer that I'd like to provide you.
That's great. And I'm going to end there because I think we've covered everything I wanted to cover. Was there anything else you wanted to say with our time together?
I am really grateful that we have this forum. And for anyone listening, I hope that the bottom line message is whichever goal you are focused on doing, whether that's professional or personal, stay focused on the process and leave the fruits of your labor to a higher power or a higher purpose. And I will tell you that it is the process that really allows for you to get better with what you think the outcome may be.
Rahul, what a pleasure this has been. Listening to your journey, what stands out to me is how beautifully you've blended science, teaching, compassion, and innovation into one remarkable career. And you're just getting started. Whether you're calming families in the pediatric ICU, guiding students through intimidating board exams, or imagining how AI will shape the future of medicine, your work reflects something deeply important. Great teachers never simply transfer knowledge, they ignite confidence. One of the themes that runs through this podcast is that our patients teach us lessons far beyond diagnoses and treatment. In your case, it's clear that your patients and your students have taught you how powerful it is to meet people where they are, especially when they're frightened, overwhelmed, or uncertain. That lesson applies just as much to a critically ill child's family in the ICU as it does to a medical student staring down step 1 or step 2. Thank you for sharing your story, your wisdom, and your energy with us today. And thanks to all of you for joining us for another episode of Lessons My Patients Taught Me. I'm Dr. Ellie Davidson, reminding you that in medicine and in life, if we listen carefully, our greatest teachers are often the people we serve. And remember, until next time, stay healthy out there.
The preceding podcast contained discussions of medical cases where names and identifying details were altered to protect the privacy of individuals. The views and opinions expressed were those of the individual speakers and do not necessarily reflect the official policy or position of any affiliated institutions or organizations. This podcast was for entertainment purposes only and should not be taken as medical advice.